Hello and welcome. My name is Dr. Raj Persaud. I'm a consultant psychiatrist based in private practice in central London, and I'm delighted to be joined today by Professor kamaldeep Bhui. Professor Bhui is a professor of psychiatry at the Barts and the London School of Medicine, based here in London, and he's the lead author of a very interesting paper that's recently been published in the British Journal of Psychiatry, and the title of the paper is Pathways to Sympathies for Violent Protest and Terrorism. And as I say, this is published in the British Journal of Psychiatry. So kamaldeep, first of all, tell us a little bit about the background in terms of the links people have found historically between mental illness, psychopathology, psychological problems, and terrorism, because that's the kind of background to this particular paper.
Well, traditionally, actually, there's been very little research into this area, and the general consensus was that terrorism was completely unrelated to mental illness, and it was entirely a political act, an act of political violence. Now, there are several reasons why that assertion has been quite popular. Firstly, there was very little research. Secondly, that any suggestion that mental illness was involved led to some concern that people were trying to justify or mitigate the acts and atrocities that took place as part of terrorism. There had been some studies in conflict zones, which clearly are very different from the sort of study that we've undertaken, which suggests depression was relevant. But I would argue that depression in the midst of a conflict zone would mean something very different from depression in the midst of no conflict zone.
Okay, you also start off by drawing a distinction, I think, in the beginning of the paper between lone wolf actors, people who act alone, and people who act as part of an organization. Could you say a bit about that? Because there is thought to be a difference in the psychological makeup of lone wolf actors compared to members of an organization.
So our study was really a population-based study on people who were living in the community, ordinary citizens. And at the time we began the work, there was very little research undertaken, even in lone wolves. But over the period of about 5 years, there has been more research emerging on what's called lone wolves. These are people who essentially are not linked with organized terrorist associations, but appear to commit acts of terrorism in isolation, unpredictably and randomly. And the word lone wolf has been attached to them. What's been found is that 44% in one study of such acts were related to mental illness. The difficulty we have is definitions of mental illness in such studies are rather general and broad and not based on any particular diagnostic classification, but on a general indication of whether mental illness is involved. And recently that's become a very important area of research for counterterrorism agencies, because previously they were unaware of any link with mental illness, and this is where the strongest link has been made. And so they're interested in understanding this better and exploring it. And so you would have noticed on the media, whenever there's an atrocity or a murder, two hypotheses are often put forward. One is that it's terrorism, and the second that it's mental illness, and the third possibility is always that the two are linked in some way. So I would suggest that although this is an important and interesting finding, we're still at a very early stage of really understanding whether these lone wolves are really mentally ill and whether mental illness drives their offending, or whether the mental illness is incidental.
Now, let's talk about your particular study. First of all, it's a community-based study. So tell us a bit about the group of people that you were studying. And the other thing, you're surveying this group of people is to find out the links with attitudes to what you describe as sympathies for violent protest and terrorism. Tell us a bit about what you mean by sympathies for violent protest and terrorism.
So we've taken a public health approach here, that you cannot solve a problem as complex as this without understanding the problem. And for us, understanding the problem, it involves talking to the communities and trying to ask them for how we would go about investigating this question. And what we were particularly interested in was this group of people who ostensibly are ordinary citizens and then decide to take up a terrorist cause, either through supporting that cause or through acts of violence. And so we wanted very much to talk to communities, and we consulted with them. And what was interesting was, despite the concerns expressed by, for example, ethics committees and the universities, that people were generally very positive, and mosques and community organizations were saying, yes, we need evidence. essentially they helped us develop the survey, and they actually put forward types of question that we could use to assess what extremism might mean. Prior to this, there's been no real instrument to look at public attitudes and sympathies towards violent protests and terrorism. The other reason we took up this approach is that in a public health context, if you're trying to prevent something, you want to identify the earliest possible signal of such adverse outcomes as terrorism in this instance, but it could be homicide, it could be depression, it could be suicide. And essentially, we were looking at the earlier part of developing sympathies for violent protests and terrorism as a signal, as an indicator of who might be vulnerable to further persuasion. And this sort of approach has been in the US, in New York, and in other public health agencies, particularly in Canada. So that's why we developed this sort of approach. Of course, it's very difficult to do this sort of work, and someone who was involved in a terrorist organization, it's very unlikely they would admit to it and volunteer information. So what we were interested in is people, ordinary people living in the community who begin to develop sympathies, who might then be susceptible to becoming involved in such causes in the future, hence the definition. And this instrument, if you like, that we developed essentially had a number of items of increasing levels of severity, including violence and commitment to terrorist causes, as a way of measuring on a score the total level of sympathies one might have.
Okay, and what would you say were the main findings of your research?
So the main findings are, these are put across several papers, but the main finding was that the levels of sympathies for violent protests and terrorism are very low, around 2–2.5%, but that these were common in both men and women. And in the paper that you referred to that's just been published, essentially we undertook a cluster analysis of this sympathies for violent protests and terrorism variable, and it produced 3 clusters, the ones that were most sympathetic and 2 other clusters that we aggregated. The main findings were that depression is associated with having sympathies for violent protests and terrorism. We had a signal of that in a previous paper, but we hadn't really understood it. And also that adversity, life events, loss events, rather than being associated with a higher risk of sympathies for violent protests and terrorism, were negatively correlated. This was a surprise because previously people had felt that sympathies for violent protests and terrorism arise because of adversity, discrimination, and nation, for example. So we found quite the opposite.
But there is an alternative explanation for that, which is that the depression that psychiatrists see, what I might call ordinary depression, for want of a better word, arises from life events like a divorce or loss of a job. But the depression that might be linked to sympathies for violent protest might be a general gloominess about the world, a general gloominess about injustice. So that's why you might find a difference there. I don't know what you think about that explanation.
I think that's a very plausible explanation. So we've measured depression in this survey using the PHQ-9 and its item-based approach. And you're quite right, the items themselves could indicate a general pessimism, a dysthymia, a lack of optimism. But what we found in the study was that adversity was related to a higher risk of depression and a higher score on the depressive item in this study. But still, adversity appeared to be negatively correlated with depression. Adversity was positively correlated with depression, but negatively correlated with sympathies for violent protests and terrorism. And the mediation analysis suggests that the predominant effect of adversity is actually to lead to a lower risk of sympathies for violent protests and terrorism, even if there is a small increase in depression and therefore a high risk of sympathies for violent protests and terrorism. So adversity appears overall, this is a cross-sectional study, so one has to be cautious, to be protective.
Okay. You also found that contact with the police or the courts carried a higher risk of sympathies for violent protest or terrorism. Why do you think that was?
It's likely that this process called radicalization is complicated. And although it's been argued that these individuals ostensibly are ordinary citizens without any previous criminal histories or contact with the police, I guess our findings suggest there is a proportion in whom this is relevant, that they may actually have had previous contact with the police and courts. This was from a life event measure, so for them it was an experience of adversity. However, it could represent previous criminality, and contact with the police in crisis. So I think that's what it means. It wasn't sustained in adjusted analysis, but it's too important. And it was the only life event or experience of adversity which was positively correlated with sympathies for violent protest and terrorism.
Now, I think one of the really interesting and most interesting findings in the research was this finding that political engagement was associated with a lower risk for sympathies for violent protests and terrorism. Could you talk a little bit about that?
So this is consistent with the consensus view that people resort to acts of protest and violence when they feel unable to change the society in which they live. And one of the theories is that they don't know how to go about democratic political processes in order to change society, and or that they're not sufficiently connected to engage with political process. And so this is quite an important finding in that it goes in the direction that one would expect, that a better political connectedness is associated with a lower risk of sympathies for violent protest and terrorism. It also is consistent with the findings of adversity, particularly loss events, because both of them argue for connections being important. And in previous analyses, we found that people who had a greater level of social network and connections appear to have a lower risk of sympathies of violent protest and terrorism. But it's a very important finding which probably needs further evaluation in longitudinal designs.
Many people might think that one of the problems with doing research in the taboo area of terrorism, and there's a sense in which one of the interesting links with psychiatry is also a taboo subject. So you start asking people taboo questions about how they felt suicidal, do they feel very low? You're eliciting people to give negative information about themselves they may not want to reveal. And that's the general problem with psychiatric research in general. But when you're asking people to talk about their sympathies for terrorism, you're also probing a taboo issue. So one of the questions is, how honest are people being really? I mean, are people really answering honestly? Is there a sense in which probably a large number of people didn't answer honestly, and you're just getting the tip of the iceberg in terms of sympathies for violent protests and terrorism? I know that's maybe an unfair or difficult question, but I don't know what you think about that.
It's a very relevant question. There will be a response bias. It is a very stigmatized area. Firstly, I think we developed the list of questions with the support of the public, and there were communities involved in developing the items, so we knew that they were reasonable items to put forward. Secondly, we tested them in the field on several occasions to ensure that they were understood and people found them acceptable questions, shall we say. And thirdly, the way they were presented within the survey was in a way that showed concern for the issue rather than we were trying to identify terrorists, which of course we weren't. And overall, very few people tended to say they didn't want to answer. They either didn't know, in which case that's still an important answer, that they might be vulnerable to further influence, if you like. And on the whole, in feedback and debriefs, it was found that people didn't mind answering these questions. The questions they really objected to was their age and income. But on answering these sorts of questions, they didn't mind at all. And in fact, they were quite concerned to find out about the survey and hopeful that better research might yield to better answers, because generally they felt that there wasn't enough research in this area. And the sample, of course, was Pakistani and Bangladeshi men and women living in the community.
So one final question. There is a sense that as psychiatrists, we're trying to develop a deeper or more nuanced understanding of why people do what they do. When you see conventional explanations being put forward for terrorist acts or violent protests, do you have a view that, generally speaking, the lay understanding of this piece of behavior is too simplistic?
I think when people see violence and unpredictable violence, one of the explanations often asserted, and we've seen this in the media recently, is that it's something to do with mental illness. So that's always a risk of researching this area, and that we may be reinforcing a stigma there. Of course, terrorism is a really complex behavior, and I think it's more complex than other behaviors that we deal with usually. And I don't think anybody has the right answer, really. And so one of the reasons for undertaking this research was to continue to investigate and to provide empirical evidence for policy and for decision-making practices. This is very topical and relevant at the moment, of course, because government is considering whether we should be having mandatory training for identifying individuals who appear to have risky language and risky content to their mental states. And yet the evidence base for that being useful as a way of preventing very rare outcomes in the future is very limited, and the evidence for it actually being a way of identifying anyone who might progress through radicalization to committing such acts is very limited. So despite it being challenging for both the public and researchers, it's too important an area. And of course, one could argue that all behaviours are linked to psychological processes to some extent. And one doesn't want to over-assert the importance of psychopathology, given most of the evidence is that mental illness is not related. But I think there is an important relation to explore here, and you've alluded to it earlier, that maybe it's not depressive illness as such, but more pessimism and negative thinking, which may be part of, for example, dysthymic personality, or there's some evidence that autism and autistic traits themselves lend people to be unable to process grievances and emotional disturbance in a way that allows them to be comfortable in managing their emotions. And there's quite a lot of work going on in that area as well. So I think psychiatry has a role to play, but proportionately and in careful collaboration with other disciplines.
What is the future direction for your research in this area?
So we're just completing another survey at the moment to replicate the findings, or hoping to replicate the findings and replicate the cluster analyses and factor analyses on the instrument. And this is on Pakistani men and women and white British men and women. What we're trying to do is explore extremism more generally. This is something we always wanted to do, but we were just insufficiently resourced and ended up having to do what we could within the resources available. It's still a fairly modest study, but what we're doing this time is trying to get a better measure of depression as a clinical disorder. We've also got measures of criminality and measures of autistic traits and personality difficulties as well. So hopefully we'll be able to unpack what this finding was with depressive symptoms and better understand what it means for future prevention.
Professor kamaldeep Bhui, thank you very much indeed. And the title of the paper, again, is Pathways to Sympathies for Violent Protests and Terrorism, and it's published in the British Journal of Psychiatry. Thank you very much indeed.